Good evening, everyone. I'm Ravi Gupta. I'm editor-in-chief of a magazine called eHealth. eHealth is a print and an online magazine which has been there for around 50 years. And we have been covering various innovations and various trends in the healthcare sector. And today we have with us our guest, Mr. Sunil Thakur. He is the managing director of Quadria Capital Advisors Private Limited. Welcome, Sunil. Thanks for joining us today.
Thank you, Ravi.
And Sunil is the managing director with the Quadria Capital, which is an Asian healthcare-focused private equity fund with managed assets of over $2.2 billion. And Quadria Capital has investments in various healthcare ventures. And before we start discussing with Sunil about that, how has the COVID-19 impacted the healthcare sector, the pharma sector, and what are the trends emerging in the sector, I will request Sunil that Sunil, please, if you can talk about your organization a bit, the overall history, the overall investments, so that audience has a context about you and your organization. Sunil. Sunil, you are on mute.
Oh, sorry. Thank you, Ravi, for hosting me. It's indeed a pleasure to be part of this forum. So just to give you a context, Quadria Capital is one of the largest healthcare-focused private equity fund. We invest in the healthcare sector and we cover South and Southeast Asia as the primary region for our investment. We've been in existence for now over 12 years. We've managed $2.2 billion across 4 funds that we've done so far. Currently, we're investing from our 4th fund. So as part of our mandate, we look to invest across the entire healthcare sector, right from delivery services, which is hospitals, diagnostic companies, to pharma life sciences, to medical devices, medical technology, and to associated healthcare services, including retail healthcare. So it's the entire gamut of healthcare sector. Anything and everything that you can associate health and healthcare with is what our mandate is. And we look to invest across South and Southeast Asia. The primary goal is basically to back entrepreneurs and strong business models in large emerging markets, which have strong inherent consumption strength. So primarily focusing on India, Bangladesh, Sri Lanka, Southeast Asian countries like Vietnam, Philippines, Thailand, Malaysia, Indonesia, Singapore, Cambodia. So these are the large emerging markets, and we feel an inherent need for healthcare. The penetration of healthcare is very limited compared to most developed markets. And therefore, the need for private capital to support entrepreneurs and lead of those geographies. And that's the basic mandate for us. We are a total of 18 of us spread between the 2 geographies, Delhi, which looks at South Asia, and Singapore, which is our primary office that anchors all investment activities in Southeast Asia. So that's it.
Great. Excellent. Sunil, I think that since your organization works in South Asia and also in the Southeast Asia, I hope in the conversation today we can understand that what is the scenario here and compared to other Southeast Asian regions and perhaps the other regions of the world. So, Sunil, the COVID-19 has affected all the sectors, and how is health sector affected? And we perhaps for the first time in our lifetime, we are all listening to healthcare concerns daily on our news channels by our politicians, by our government officials, and all citizens. In fact, the awareness level of the healthcare sector has never been so high. But is it has it turn the tables in a positive way for the healthcare sector or negative way? Sunil.
Yeah, Ravi. So, just like any other sector, there is an impact on the healthcare sector as well. So, as all of us know, because of this lockdown and whatever is happening globally, the economy has contracted, and the effect of which is also seen in the healthcare sector. But two important elements when it comes to the sector. First is that it has now become front and center of policy making. It's the sector that is right there in the front to deal with the pandemic that we are talking about. Second is in terms of performance, it is not as badly affected. If I look at the overall healthcare sector, it is not as badly affected as most other sectors are. So that's the overall take on how the healthcare sector has fared. Now, in terms of the trend, if I talk about of the impact, good or bad, I will just break it up into three big components. The biggest one is the healthcare delivery services, which is mainly hospitals and diagnostic centers. That's the segment that has been badly affected. It's primarily because people had stopped going to the hospitals. It is on account of lockdown. It is on account of announcements, precautionary announcements that were made by the government, our prime minister. And third is obviously the fear of, catching the infection. So that has badly impacted the healthcare delivery side of the business. And as you would know, healthcare delivery constitutes roughly around little more than two-thirds of the total healthcare sector. In fact, inches towards three-fourths. So that has been badly impacted. We have operated for the last 2 months at about anywhere between 20 to 35% of the capacity utilization, and at very low yields. So that has significant impact on the healthcare delivery. When I come to the second big bucket, which is pharmaceuticals. So pharmaceuticals is sort of where it was pre-COVID. Some have done better, some have done worse. But overall average, I would say pharma is not badly impacted. The demand was still there in different forms. What impacted pharma to some extent was the entire supply chain that broke, especially in the initial part of the lockdown. So I would say pharma was equals at the end of the analysis. The third big component is the entire emerging healthcare models, especially the digital tele models. That has had significant amount of traction. So that's completely taken off in a different direction. So if I just equate this, healthcare delivery negative, pharma is what it was, and the new models obviously has taken off. If I talk about sheer numbers, the impact that we see on the healthcare delivery side, if I was just to take our estimate for the year, would be that the revenues would get impacted by anywhere between 10 to 17-18%, depending on base and pessimistic view. That would be the case for even diagnostic. Diagnostic maybe a bit higher also. And as far as pharmaceutical is concerned, I would say it will be in a positive zone compared to where we were the last year. Now, that's an estimate that we have as of today. It all depends on how ultimately this entire situation of both the pandemic, the disease infection situation, and the lockdown and the stimulus package is going to work on the economy. So ultimately, a lot of it will depend on how that pans out, and that should get much clearer than where we are today in the next month, 2 months.
So you have broken the scenario into various pieces, various sectors. Sunil, government has recently announced a package which is 20 lakh crore package, and it has discussed about MSMEs and various other schemes, and it is a Some people have called it is a more loan-oriented package where organizations are uh, given more options to get easier loans. So, do you see any packages in that 20 lakh crore scheme that the health sector will have a benefit uh, from?
Yeah, so in the overall announcement of 20 lakh crores, while the intent is very right and in the positive direction, as far as the healthcare sector is concerned, I think the government can do much more than what it has announced. And if I just talk in terms of figures, 20 lakh crore is the overall package. So far, if I sum up all the announcements that have happened for the healthcare sector, and I would include the big announcements with respect to, say, the pharmaceuticals or medical devices, uh, the overall package will not go beyond 15,000 crore. Now, that is roughly around 0.7, 0.6%. Now, if I just take two comparisons, in US, on a total overall stimulus package of $2 trillion, we have roughly around $250 billion going to the healthcare sector. That's little over 10%. So comparison, we are short of where other markets are. If I take the second figure, which is that government plans to inch up to at least 2.5% of the total government GDP towards healthcare. So even if I take that number, ideally we would have expected at least 2.5% of the total package for the healthcare sector. If I take the third aspect, that this is a sector that's standing out to serve the population. We believe that it warrants a much higher package or amount than what the government has announced. But I believe that announcements are still happening, and we are very positive, and we believe that the government will certainly come up with certain more measures to instill confidence in the sector. But bottom line, we badly need more stimulus. And between all the components of healthcare, if I take pharma, medical devices, which have already received announcements of about 7,000 crores in one sector and about 3,500 crores in the other one, other segment. Healthcare delivery is the one that's fighting on the ground. Not to say the others are not, but that's the one which is the biggest, has suffered the most, and is in need of more package or stimulus package from the government.
And recently, there are some reports in the papers that hospitals have demanded that they also be considered under the MSME sector itself. So, like they are considered as an MSME sector, so that they are able to avail the some of the benefits announced by the government. And there are also reports that some of the hospitals are under severe financial strains, and some may go bankrupt, or like are available for sale. So so how do you see this like situation on the ground actually?
No, it is certainly a very serious concern. And it's very, very important that we come up with measures that help and that encourage the sector and the stakeholders in the sector to continue doing what they've been doing in the past. Just in terms of sheer numbers, there was a study done by Ernst & Young in association with FICCI, and they've put a number of anywhere between 15,000 crore to about 22,000 crore of loss, over one quarter, depending on what scenarios we play with. Capacity utilization of 20% will give you a loss of around 21,000 crore. A capacity utilization of 35% will give you a loss of around 15,000 crore. Now, these are significant amount of money. But more than that, I think it is for the stakeholders who are out there battling this pandemic. in line with what the expectations are. It's important that there is more confidence building measure that comes from the government side. The government has started to do it. They've come up with this insurance scheme for the COVID warriors of 50 lakh rupees. They have done something for the ASHA workers. But I believe that there can be some more measures and substantial measures that can be announced to instill confidence and encourage the sector to operate the way they've been operating in the past and also during the COVID.
One of the trends which we are seeing across the cities, that city administrations have taken over some of the private hospitals to be treated as COVID hospitals. And many have asked the hospitals to secure beds for the COVID patients. And this shows that there is a recognition among the district level authorities that government cities in the district level are not enough to meet the current challenge of the growing number of the COVID patients. Enough doctors in the government systems are not available. And but there seems to be less policy recognition that these private hospitals also need financial support and immediate support. Like I haven't come across any state governments announcing any stimulus package or financial support that since the private hospitals are helping the government in managing this pandemic situation, there are assistance being provided to them. So have you come across any cases across the country where supports have been available to the private hospitals who are helping the government in this situation? And there have been reports that since the COVID-19 requires higher level of expense in terms of managing the patients, the cost of the PPE kits and all the facilities. So the cost of treatment of the COVID-19 patients is much higher, which is again a constraint. So are you seeing any supports from the governments to handle these situations?
At a macro level, I believe the government can do much more to encourage private sector to keep fighting, the way they have been. But if you ask me a question that has the government done anything? I think it's been done in bits and pieces. There is no coherent approach, and this is one time when the governments, be it the federal government, all the governments can come together, the state government and the central government, with a very cohesive, very clear strategy of capacity building, and capacity building would include a big part coming from the private sector. So it is basically these times when you can come up with a coherent strategy to deal with pandemic, and at the same time deal with the contribution and the support, the contribution that can come from private sector and the support that can be given to private sector, and it can be in various forms. Today the government should stand as a buyer of service, fully support, rather than capping prices. It can very well manage prices by bringing in its buying capacity. Second is that we can expect the government to basically contribute to some of the additional costs that the hospitals are incurring. The cost of servicing patients has increased dramatically because the protocols required to service the COVID patients to manage the hospitals, including equipments, PPEs, all of that, is significantly higher. So on one hand, the cost has gone up. On the second hand, there are stipulations that we cannot charge more than X amount. So that basically is, I believe, is not in sync with what we should be doing and what we want to achieve. And that is where I believe that the private sector is looking towards the government to bring in that kind of support. in this time.
So, what is the investor sentiment in these times now? Like seeing the overall situation.
So investor sentiment, Ravi, I would say is mixed to positive. Uh, and the way I would like to break it, you need to look at this from different lenses. There are investors who are generalist investors, can invest in any sector. They obviously are, under mixed. I would place them under a very mixed bag because since most of the sectors have taken the brunt of this lockdown, they are concerned about their existing portfolio companies. So that's one way to look at it. That are you a generalist fund or are you a healthcare focused fund? So healthcare focused fund, if I take their case, I think it's mostly positive. But again, they have people who have a healthcare delivery in their portfolio. They are working with their portfolio companies to come out of this situation of grave financial constraint. But if I look at, on the other hand, in terms of opportunities, uh, healthcare sector is throwing tremendous amount of opportunity. Uh, and with that, what is happening is that healthcare funds are actively pursuing deals. Uh, could be on a selective basis, or could be on a very aggressive basis. Uh, and then when you look at generalist fund, people who have dry powder, they are also looking at healthcare sector. So there is a pressure that is going to come in terms of the significant amount of dry powder flowing towards the healthcare sector. So there, those are multiple lenses that we need to look at. But overall, if I talk about healthcare sector and private equity interest in the sector, I would say it is more positive than what other sectors are going through. And most people see opportunities in the sector. That's the overall investor sector sentiment. If you talk about specifically, if I talk about Quadria Capital, we believe that these kind of crises do show up opportunities basically to be able to strengthen the healthcare sector, which is for the betterment of the society. Opportunity to bring in efficiency in the sector. Again, that leads to better cost. Opportunity to adopt to models that can basically help in access, that can help in quality. So these are models that throw up a good amount of opportunity, and we are looking at these kind of opportunities to invest.
Sure. And what are the important considerations for PE investors? Like, what are you looking at?
So the important considerations are basically different, I would say. We are looking at various kind of themes, various kind of models. So themes that are catering now towards access, that are catering towards convenience, that are catering towards efficiency, continuity, prevention, and quality. So these are the mega trends that we are going after. Now, what is supporting those themes and theses is three important things that we believe COVID is going to bring in and has already brought in to a large extent. First is the significant amount of behavioral change that has happened. On account of consumers, the way consumers are looking at consuming health services, the way hospital owners are looking at reaching out to the patients, the way clinicians are now adopting, their change of how they are reaching out to their patient base. The behavioral change has been very, very significant. The second is the regulatory support. There is a significant amount of regulatory support that we expect will come. Some of it has already come in. The very fact that what we could not achieve in the last 3 to 5 years on a telemedicine policy was achieved in three weeks. Uh, e-pharmacy is being encouraged. So there is a significant amount of regulatory support. And again, as part of that, talking about self-sufficiency, self-reliance, Atmanirbharta, our Prime Minister's goal. Those regulatory changes are very, very positive, and we believe there are quite a few more which will come in. And the third big catalyst is the commercial compulsions that most entrepreneurs are now looking at. Be it on the hospital side, a lot of entrepreneurs have now been forced to open up the entire model to see how they can save cost, how they can improve quality, how they can digitize. That has now become a commercial compulsion. On the product side, people are now looking at supply chain. How can they strengthen supply chain? How can they, vertically integrate? How can they create supply base? Either in a very localized area, or within the country, rather than depending on foreign countries. So commercial compulsions are now breaking open those old conventional models. So these are the three big catalysts which are going to drive the trend going forward, and that's what we are going to look at in the models that we plan to back.
And in your answer earlier, you had talked about technology. You talked about IT, and and as you mentioned about that telemedicine rules have got eased out, pharmacy rules have got eased out, and also in the address by the finance minister, like there was a mention about the national digital health initiative. So how are you looking at this IT companies which are going to get into the health IT space in a bigger way?
Yeah, so very promising, Ravi, and it is going to be the future, both in terms of front-end business and also the drivers of the conventional model. So we will break it into two parts. So as a front-end business, if you look at things like e-pharmacies, the revenues have gone through the roof, and as part of that, telemedicine, digital therapy, that has taken off, in a very big way. So these are all frontline businesses where technology is used right from the back end till the front end. Then if I look at technology from a support service and support model for conventional models, significant amount of reliance will now be on digitization. If I just take the case of, say, hospitals, telemedicine will be part of it. The entire workflow, most serious large players will look at workflow changes. We don't expect nursing homes and in smaller hospitals and tier 2, tier 3 cities doing it, but they will start to take a cue from what the bigger hospitals are doing. But all the bigger hospitals are now going to focus on the entire workflow, on EMR. All that is going to be driven by technology. Government's intervention is going to be significant. The whole data stack, national health data stack that we are talking about, especially through the NHA program, is going to be a big catalyst, because what it will do is that government's entire buying program of service, which is Ayushman Bharat, will be driven by a digital model, and they want to create a very closed loop program whereby it creates efficiency, plugs any kind of loophole, fraud. So what it will bring is, the moment it finds a big traction with providers, with more patients being sponsored by NHA, hospital will have no option but to join that closed loop program, and that will basically encourage and accelerate the entire digital program, right from EMR to your payment models, to your data analytics, going into artificial intelligence. All of that is going to get into a very virtuous cycle once you find a big buying traction through the government's NHA program. So all these elements, be it private sector using technology as a front-end business, be it private sector using technology as a back-end support model, or be it government driving its purchase program, will see technology becoming the central focus for all these stakeholders.
And what's your advice for the existing promoters of the healthcare businesses? Like, how are they going to handle this situation, and what is the change in strategy or vision they should bring in?
Yeah, so my advice to entrepreneurs would be that one should deal with both the short term crisis and the long term model opportunity at the same time, because it is giving both opportunities. Well, the first one should not be taken as an opportunity, but it's a compulsion that one has to deal with. So starting with the mindset, which is very, very important, because everything flows from how you look at the situation in front of you, and with what mindset are you dealing with it and solving it. It should be a very positive mindset. So while in the short term we are dealing with a crisis, but at every step, use this crisis as an opportunity to bring about a long-term change. And this could mean, right from how you see the overall revenue model, how you see the overall cost structure in your hospital or in your company, in your pharma company, or in your medical devices company. Um, and how do you look at the long term? So if I just break it up into few things, uh, look at the sources of revenue, because now you would see how COVID has impacted. If you were already in the telemedicine model, and if you would have adopted the telemedicine kind of a model, you would have at least had the opportunity of servicing outpatients. So that is on one side, which is both treating your existing patients through a telehealth model as well as getting new patients, because in any case, people require healthcare even during lockdown. They required. So, you were ready, and you could have still got some kind of a revenue. So that's just one aspect of example of flavor of what one could have done and what one could still do. If I look at cost structures, cost structures start with marketing, which is the first expense that goes out, apart from obviously the big expense, which is manpower. If I start with marketing, what better ways could we have used in the past during the crisis or in the future to basically market our programs? And that again calls in for adoption of digitization. It's a very inexpensive way to reach out to people. So that's one. If I look at manpower, one should study the entire workflow of delivery that one needs to do to see what is the optimal manpower strength that one can work with, and how one can subordinate or substitute some of the work that can be handled by technology as against using manpower. So that particular aspect is very, very important. There are quite a few models, IT models available, where some part of the job that is being done by the paramedics or other manpower can be handled through technology also. So that is the second aspect. Then the third aspect, look at the administration cost. What can be outsourced? What technology can we use to minimize the cost? Then look at data analytics tool to understand what is the throughput, what kind of patients can create traction on the front end revenues, what is the cost structure that can support that kind of a revenue. So you have to break open the entire model to see where all cost savings can be done, and more importantly, how you can use the current situation, current crisis, to see that whatever model we adopt in the near term can basically be used on a sustained basis for a long term. It's again, whatever we are doing at home, I'm sure all of us are learning new things in our daily lives that we think, we could, this is something that is better and it can be adopted for a longer, sustainable period. The very fact that we are doing this webinar on a Zoom, and as if, we're sitting there on the stage doing a fire chat is a big change. Now, a lot of people, I'm sure Ravi would be thinking that there are lots of ways by which you can cut down on cost and be as effective as you were, with that old cost, and meet the same and meet your objective. So that's the way, I would suggest entrepreneurs to think. One additional element, I talk about hospitals, is that how do you now start to look at generic medicine, because medicine is an important component. That there are various models of procurement that one can adopt, and it can bring a significant amount of differential value to your cost structure. If you look at generics, and you need to buy it from good generic manufacturers, you'll get the same quality, but probably at a much lower price. And you are able to service patients who are under package at a low price point and still make some kind of margin. So all those thought process is what entrepreneurs should now take up and see that they bring in a change that's sustainable and for long term.
Very interesting. You have talked about cost reduction and focus on cost efficiency and usage of more digital by the hospitals. Another aspect which I want to ask you about this whole medical equipment industry and the PPE industry. Like there are reports that from a very, very small size of this industry of the PPE industry, it's like around 7,000 crore industry created in last 2 months or 3 months. These are the vague reports. I don't have any authentic numbers, but I saw these reports on paper in the newspaper. And another aspect is like look at the situation of ventilators. When the pandemic started, there were governments, and still there are many organizations looking out for ventilators. Like Delhi CM has talked about the number of ventilators Delhi has and how much they have occupied, like how much are being used or not. And so, are you seeing an opportunity for the medical devices industry, medical equipment industry to really get a boost now? So,
there is certainly, Ravi, good opportunity for medical devices industry and for medical devices entrepreneurs. And the industry has done very well and commendable job in terms of how they've scaled up in some of the products that was needed in these times. So commendable job by the industry. But my only suggestion is that to entrepreneurs is that we should avoid getting into a herd mentality kind of a situation, because some of these opportunities may not remain for long term. These are crisis born situations or opportunities. And in this, while we have those kind of big numbers that you mentioned, one is not sure of, who are the serious players, who are the long-term players, who are the quality players. So I would say the verdict is still out in terms of how ultimately that segment of the industry will pan out, if I was to take a 1-year horizon. And therefore, an investor like me would not go behind that kind of an opportunity because it's short-lived. Ventilators, we are producing the moment this goes away. The demand will certainly collapse. So I believe that it should be left to entrepreneurs who can deliver quality, who can deliver it at a best at a good cost. And are serious about long term. If they want to be seen as attractive proposition for any investors, that's the way I would look at it.
There are some questions here on the screen, and one question is about it is time for the second question I'm like taking it first. It is there's a question by Subha, and he's talking about that healthcare industry is moving to more automatic and robotics, touchless operations, and digital handling. So, are you seeing opportunities for contactless hospitals?
No, I think we are, see, we are talking about these kind of models. But India is still some time away from, the touchless kind of models. I would say we are still, 7-10 years away from these models to come and operate in the kind of environment that we operate in.
Sure. Uh, there is another question that do you see that current disrupted situation of distribution and supply chain logistic scenario as a major barrier in investment in healthcare? And also, do you see yourself doing any new investment by you in Indian healthcare sector? Do you see any ROI? This is by Siddharth.
No, so as far as the supply chain breakdown is concerned, I see as an opportunity. So if a supply chain has broken down, and when I spoke about trend, I mentioned about continuity. So continuity means that in these kind of situations, the supply chain and the production should not break down. So any model that is able to serve and service, the industry will become very, very attractive because people will go after those kind of models. So to see that the supply chain doesn't break down. The second part is that on the front end, we would look at investment opportunities that are fully integrated. Where the reliance on external factors is limited. Uh, so, I would again see this kind of a crisis as an opportunity in various forms, as I mentioned to you.
And there's a question by Ashwin. He's asking that is the current regulatory climate conducive to the investment in the pharma sector in India? What are the key issues of concern for someone investing in the sector?
No, the current environment is certainly conducive as far as pharma is concerned. There is no doubt, but we believe that if there is more money behind the intent, that will just encourage local manufacturers a bit more than what and where they are. So if I take the case of API, government wants to be self-reliant. Today we are importing 70% of our API, 70% plus of our APIs from China. We want to bring that ratio down, and unless we offer big incentives, I don't think we will have any dramatic change in the situation. So, like I said, government is moving in the right direction. More can be done, and we hope that it will be done. But from an opportunity perspective, we believe that it's a positive sector to evaluate and put our money behind.
Since you mentioned about China, Sunil, there is this discussion about Atmanirbhar, which our PM has talked about. So, what are the opportunities for becoming Atmanirbhar in the healthcare and the pharma sector?
So, this Atmanirbharta is mainly relevant for the pharmaceutical sector or the medical devices sector. So these are the two big sectors that will get impacted in a positive way, and it's all about us having the capability and capacity to be fully backward integrated with less reliance on any external factors or any external country. And as I mentioned, government has taken the measure. There is a SOP which has been announced for API industry. There are some 53 products for which the SOP has been announced. But obviously, we are waiting for more clarity of how it will be implemented. And implementation is going to be very, very critical. The sooner we implement, the more clarity that we implement this with, the more success we will see in whatever we want to achieve.
There was a statement by Kiran Majumdar Shaw this week that healthcare sector can be the new IT sector of India. I hope you would have heard that statement. And your views on this statement itself. So,
No, it has all the makings to become the IT sector, but it is fraught with lots of challenges. IT sector, did not have legacy when it became big. There wasn't a 50, 60 years of legacy when it became big. It had sort of, again, just throwing a number, 7-10 year kind of a legacy. And the entire industry was a very contemporary industry. And they got together to set up NASCOM, which became, the focal point to basically energize and drive the entire industry. Healthcare sector, is a bit different from IT industry. It has lots of baggages. There are multiple stakeholders and well entrenched stakeholders. Um, and then it is right in the center of policy making. It happens to be in the social sector. So from all angles, it's a very complicated market. But one big catalyst or driver to break open this is going to be technology and digitization. And possibly she may have said this in that context. I read her tweet today. So possibly it may have been in that context. So I agree to some extent, but or I would say a good extent. But it is a bit more complicated than what IT industry was when it became the IT industry.
and since we are at it, I would also like you to talk about bit about the size of the healthcare infrastructure deficit in India. Like how, when this pandemic started, you were having newspaper reports talking about the number of beds are very less in several districts. One of the CMs said that he is not welcoming migrants because healthcare infrastructure in the state is not good enough to handle the situation. So, can you give some numbers, Sunil, that what is the what is the optimum level of hospital beds required in the country and how much we have, and whatever the deficit is perhaps the opportunity as an investor. So if you want to talk about that, Sunil.
Yeah, so but definitely, our market is highly under penetrated from all perspectives. If you look at number of beds, we need at least double of what we have today. If you look at number of doctors, we need at least double of what we have today. Same is the case with nurses, paramedics. So on all counts, we are significantly under penetrated. By at least uh, you know two-thirds, I would say between two-thirds and one half. So that's the headline number. And it is more acute when it comes to tier 3, tier 4 cities. The access to healthcare in rural centers are very very challenging. People have to walk at least 30 miles, to get the first point of decent healthcare access. The second complication is that we are a very divergent market. So in some states, our doctor to patient ratio is highest in the world, and in some states it's the lowest in the world. So that equal spread, is as in it is very very divergent. Kerala has a fabulous healthcare infrastructure. South is has a fabulous healthcare infrastructure. If you look east, if you look at Bihar, if you look at Jharkhand, you know. One of the statistics was that there was no medical college in the last 40 years or 45 years that has come up in in that location. Now, these are big catalysts. You have medical colleges, you get doctors, some people will settle there, you build infrastructure. So, attracting talent becomes very, very easy, because healthcare service or provision is not only about building, four walls. It's also about getting people and resources. So we have primary healthcare centers across, all the districts and all the villages. But there are no people to man it. Be it nurses or whosoever is required over there. So that is a bit of a shortcoming, and it should be looked at in a very coherent and cohesive way to solve the problem. It should not be just put the bed and no manpower, or it should not be put the manpower, no beds. So it needs to be dealt, and government is doing it. To give credit to the government that there is a vision, there will be challenges. I think if we can accelerate and if we can make it more cohesive, more coordinated, I think we will reach our goal sooner than what today we think we will reach.
Sure. Uh, there is a question here by Shweta, and the question is that after COVID medicine is discovered, what's the progress you see for the pharma sector? Will
Sorry,
the
I didn't get that.
like after we have the COVID-19 medicine discovered, will the pharma sector boom as much as it is
No,
perhaps?
see, it won't. It's not like it will boom. After the discovery, it will have a good growth rate, but nothing tectonic will happen. There won't be a paradigm shift in how the sector will behave once it's discovered. Because at the end of the day, if it's vaccines, you will give it to X number of people, and that's about it. Unless it becomes a recurring feature and one has to take that medicine, but nothing dramatic, as in nothing. There would not be any tectonic shift in the sector. But yet, yes, companies that either discover that drug or get licenses, they will certainly do better, much better than most others. And that will be a positive thing for the country, for the sector. But it is not that suddenly a $30 billion pharma industry is going to become a $60 billion pharma industry. That I don't think is.
Sunil, your organization operates in India and also in the Southeast Asia. You mentioned about Singapore, Vietnam, and various other countries. So, how do you compare the Indian healthcare uh, investment market compared to the other markets you are in?
No, all markets that we are in, and we our objective is basically to invest in emerging markets that have inherent domestic need and demand and a decent supply base. And these are all large countries that we look to invest in. And in some ways, there is that secular trend that we find common in all the markets. But beyond that, obviously, healthcare is more of a localized market. Markets behave in different ways. So if I compare India to other markets, obviously India is a very large market. It is 1.2 billion population. It's a very large market. Second is that India has a decent and quality supply base in terms of quality and number of clinicians, in terms of a very mature pharma industry, in terms of decently mature medical devices industry. So India that way is well placed compared to most other markets where it has a significant demand and a decent quality supply base. But not to say that other markets are not attractive. All of them have inherent strong demand and a decent supply base. But it's just the size and quantum where India sort of takes the lead compared to other markets. But we see, at a certain point, till a certain point, we see there is a lot of commonality, and beyond that, it's basically individual markets operate in different ways.
Sure. And you mentioned about the supply base, and like as a one of the last questions I want to ask you about. There have been like news about shortage of medical staff, nurses, trained manpower at that level. And how do you like assess the situation? Are we having more doctors that we need, or is it the other way around? And same thing for nurses and the other paramedical staff. And do you see that medical colleges are also a good investment opportunities if by any chance? I don't know how it works. Sorry.
No, so there is certainly an acute shortage of manpower, and both clinical and non-clinical. So we're starting with doctors. There is an acute shortage of doctors, both general as well as specialist doctors. It gets more acute when you talk about nurses and paramedics. So we believe that hospitals, building the infrastructure is a function of money, and within 1.5 years you can construct a hospital. But getting the right set of manpower and the right quantum of manpower is much more challenging, and that is where some people lose the plot, where they don't realize that the important part of the business model is the manpower and not the four walls or the machines. So we believe that if that part gets solved and government has to play a very important role, I think we'll be in a much better position and much attractive proposition for any investor or any entrepreneur who wants to look at this sector.
So I think we will end it here. And before we end, Sunil, your message to a lot of healthcare startups, a lot of healthcare ecosystem players, that in these challenging times, what is your message for hope to how to handle the next like 3 months and 6 months, which is the hardest, perhaps? Yeah.
My message is simple. I quote Mr. that in times of serious crisis, you look at opportunities. And as I mentioned earlier, also, first I think one needs to be with a clear mindset, which has to be positive, and look at solving it for a longer term while managing the shorter term crisis. So most of the activities that you would look to do to manage short term crisis is what will help you in managing long term sustainable model also. So that's what you do, and it's all about coming back to conquer the world at a different point of time when the market stabilizes. But today you have to consolidate your situation, consolidate your position, whatever it takes to survive, and then basically figure out the right time to come out of it and grow the business. Be brutal about cost cutting. Don't procrastinate. Take decisions. Every day is going to count. Sit with the team. Have an open session with the team to see how you can create a confidence building measure within the team. Look at marketing cost. Look at administration cost. Look at electricity, power, utility. There are lots of areas. If you open with a clean slate, you will figure out that there was at least 20-30% of fluff that was sitting in the cost structure. Adopt newer models of healthcare. The world is going to change. It may change slowly. It may change quickly. But what will differentiate between a winner and a loser is going to be how fast you adopt yourself. How fast you change your system. That will decide between a winner and the runner-up. So that's my short advice.
Excellent, excellent inputs, Sunil. I think this conversation has been very, very useful, and your overview of the sector, like you are seeing it from a very high level of matured, and you are seeing the whole ecosystem change and evolve. And thanks for all the excellent inputs and ideas and suggestions you have given to the ecosystem players. And I thank all the audience who are watching this on Zoom and also on the Facebook. And if you have liked the session, please like and share this video on Facebook and YouTube, so that these ideas reach to larger number of people. Uh, Thank you, Sunil, for this. Yeah.
Thank you, Ravi, for hosting me, and it was certainly a great pleasure to be on this platform. And I thank all the participants and keep safe.